we all are very aware of the influenza, which is a very common disease almost affecting each one of us at one or the other time of the life. It is, though it apparently seems to be a very trivial injury, but at times it causes havoc. It is said that if you treat influenza, it goes in 1 week. If you don't treat, it goes in 7 days. That is, of course, a very usual story. But at times it becomes so havoc that it takes the life of our patients. So I start this talk with certain points in the background, and I'll discuss my topic under these heads: introduction about the vaccine, influenza, the illness itself, influenza vaccine current recommendations, influenza vaccine the evolution, influenza vaccine the revolution, and the world's first VLP influenza vaccine. Now, why vaccine? We have experienced in our life that many diseases can be prevented by vaccine. And you can have a list in front of you that so many diseases now we can prevent. That is, most common hepatitis B, the Japanese encephalitis, meningococcus, rabies, rotavirus, shingles, smallpox and tetanus, of course tuberculosis, and varicella yellow fever. The impact of immunization on vaccine preventable disease, you can see that smallpox is almost 100% eliminated from this country. Diphtheria 100%. With the morbidity, annual morbidity was 5,30,000 and it's now 99% controlled. Mumps 95%, and so on and so forth. But are the vaccines are meant only for the kids? No. Even we can prevent many diseases in the adults also by proper vaccination at proper time, and that is, of course, the hepatitis A, B, shingles, whooping cough, mumps, tetanus, pneumococcal disease, chicken pox, meningococcal disease, measles, etc. Vaccine preventable disease in adults, VPD kill hundreds of times more adults than children every year, and you will be astonished to know that most of these deaths occur due to pneumonia, influenza, and hepatitis B. Adult immunization coverage levels are generally low, especially in the developing world. In the absence of adult immunization, many adults, especially the high-risk group, unnecessarily remains vulnerable. Now, what is influenza? Which commonly we know as flu. Influenza enters through the nose and settles in the respiratory tract. It is caused by a virus. Approximately, a rough estimate is that about 5 to 20% of the population is infected with influenza virus every year. A highly contagious, acute respiratory illness caused by influenza virus occurs in two different patterns. One is the local one, that is annual seasonal epidemic occurring during the months of winter, temperate countries, and year-round in the tropics. And the wider aspect is the global pandemic. May occur during any season, may include multiple waves lasting more than a year total. Influenza pandemic in the era of virology. If you see the background of this, that how much havoc this disease has done. 1889, 1890, the pandemic was caused by the Asiatic and Russian flu. About 1 million people died, and possibly the culprit was H3N2 virus. Then in 1918, 1920, Spanish flu. In 1957-58, the Asian flu, which killed 1 to 1.5 million people, and the culprit was H2N2 virus. Hong Kong flu, 1968 to 1969, which killed 0.75 to 1 million people, and the culprit was H3N2 virus. The Russian flu in 77-78, no accurate count of the deaths is available in the statistics. But in 2009 and 2010, even our own country was also involved in it by swine flu pandemic, which killed more than 18,000 persons, and the culprit was H1N1. So conclude, influenza is a very potential fatal illness also. Influenza, the magnitude of the problem, the World Health Organization globally reports approximately 500 million cases of influenza infection, and between 250,000, 25 lakhs and 5 lakh deaths annually due to seasonal activity. Influenza, the clinical implications. How we see a patient of flu or influenza. The symptoms are very trivial, sometimes very distressing. Fever, headache, dry cold, sore throat, muscle aches, and the complications can be bacterial pneumonia, otitis media, and sinusitis. Worsening of the chronic medical conditions. If the person is already having certain chronic illnesses like asthma, COPD, congestive heart failure, and diabetes, and if he gets an attack of flu, the condition deteriorates very rapidly and can kill him. Which virus causes influenza? We have 3 types of virus of influenza, A, B, C. The A, B is responsible for seasonal epidemics. The influenza A virus can infect humans, animals, and birds, responsible for annual epidemic and pandemics, classified into different subtypes and strains based on 2 glycoproteins present on its surface, and these are H and N. Infection in human is typically caused by viruses displaying H1, H2, H3, and N1 and N2. Influenza, the positive virus B, infects human, responsible for annual epidemics but not pandemics, classified into 2 distinct lineages which often circulate together, and 2 strains identified are Yamamata and Victoria. Influenza C virus produces only the mild respiratory illness. Current vaccines do not protect against type C virus. Who should receive the vaccine? Seasonal influenza vaccine. The international recommendation is by the CDC is that routine annual influenza vaccine is recommended for all healthy persons aged more than 6 months. The WHO recommends that all people at high risk of influenza-related complications, for example, in adults and children with chronic conditions, for example, respiratory disease, asthma, COPD, CV disease, CAD, CHF, diabetes, metabolic diseases, cancer, chronic renal disease, chronic liver disease, immunocompromised, seniors aged more than 65 years, pregnant women, and children from 6 to 59 months. The WHO recommends that people capable of transmitting influenza to those at high risk complications, for example, the health workers, both to prevent sickness and to prevent the spread to the other patients, women at all stages of pregnancy, breastfeeding mothers, household contacts of persons in high risk group. In India, the recommendations are currently this vaccine has not been included in national immunization program. The Society for Geriatrics recommends that all elderly people should receive this vaccine. The Obstetrics and Gynae Society of India recommends in all pregnant female beyond 26 weeks of conception. Recommendations of Ministry of Health and Family Planning recommends for all health workers, and the recommendation of Indian Academy of Pediatrics, whereas vaccine is desired and requested by parents. What are the benefits of influenza vaccine? The benefits are, it reduces the likelihood of developing flu, requiring a medical visit by about 60%. 2, it reduces the severity of disease in those who do develop flu. 3, reduces likelihood of transmitting infection. The influenza-related pneumonia by about 60%, which is a very important reduction by 50% to 77%, and influenza-related deaths by 75 to 80%. Influenza vaccine, the evolution. In 1938 and in 1938, after 5 years, the first monovalent vaccine was developed. In 1940, they identified the influenza type B virus, and in 1942, first bivalent vaccine was developed. In 1978, first trivalent vaccine with 2 influenza A and 1 influenza B strains were introduced. In 1938, first egg-based influenza vaccine was formed. In 2007, first cell culture-based influenza vaccine is launched in Europe, and in 2013, first insect cell culture vaccine was approved by US FDA. Influenza vaccine revolution. Now this was the evolution, how this vaccine was evolved. Now what is the revolution? Well, the revolution is the VLP technology. What is VLP technology? That is virus-like particles. Virus-like particles resemble virus but are non-infectious because they do not contain any viral genetic material. Those were developed over 40 years ago for hepatitis B virus. So this technique was already there since last 40 years. More recently, VLP have been produced from components of a wide variety of virus families. VLP can be produced in a variety of cell culture, including mammalian cell, insect cell, yeast, and plant cell. Infectious influenza virus with surface antigens, lipid membrane, internal protein, and genetic material that gives the structure to this virus. And now what is the VLP, which we develop virus-like particle? VLP is a non-infectious and more efficient way of presenting antigens to the immune system. Attenuated as VLP vaccine. Since VLP lack genetic material, they provide a safer alternative. Attenuated virus, which have been used till now for vaccine. Research suggests that the VLP vaccine against influenza virus could provide a stronger and longer lasting protection than conventional vaccines. Production begins as soon as the genetic sequence of a strain is identified, becomes available, and takes as little as 12 weeks as compared to 9 months for traditional vaccine making. In early clinical trials, VLP vaccine for influenza have shown complete protection against both the influenza A virus subtype H5N1 and in 1918 during pandemics. Influenza VLP do not contain genetic material. The particles which develop like virus they do not have genetic material, but do have the antigenic material in forms of heme, and they are identified as H, that is heme agglutinin, and N as the neuroamidase. Hence, influenza VLP are non-infectious, non-replicating, with intact active antigen required for induction of both humoral and cellular immune response. VLP-based vaccines have also shown to provide protection against different strains of the virus other than those for which the vaccine was found. With influenza virus mutating rapidly, the previous year's vaccine produced in X often cannot be used. VLP enables creation of vaccine that exactly matches the specific pandemic strain and offers a strong seroprotection against both subtypes of it. And the third point, which favors this technology, is VLP-based vaccines are also safer and do not bear the risk of becoming virulent again. As compared to the traditional egg vaccines, since the 1950, egg-based production process remains the standard method of producing seasonal flu inactivated live attenuated vaccine. The flu H1N1 pandemic of 2009 highlighted the limitations of the current egg-based methods in the case of emergence of a pandemic strain and main isolation to final dose formulation and validation. So this long period of identifying the virus, then making a vaccine against it, it took a very long time, from 6 months to 9 months, and by that time the pandemic has already caused. Versus VLP vaccine. If you compare the two processes, with new strains of influenza virus emerging every year, this virus developing a new strain very soon. With new strains of influenza virus emerging every year, it is essential to develop faster methods of vaccine in terms of cost and efficiency. Egg-based vaccine technology, for example, requires about 900 million eggs to produce vaccine for the US population against influenza outbreak. And in case of a deadly virus, the process is even more ineffective and time consuming. Now if you see the picture of these two, the influenza virus, which has H and N spikes on its surface, the M is inside the virus, RNA genome is there, and no genetic material. In the vaccine VLP, which exactly mimics this virus, but lacks the genetic material which causes the deleterious effects. World's first VLP-based seasonal influenza vaccine was developed by Catalan, that is now going to be available as Catiflu S. Catalan Pharmaceuticals Limited, along with the world famous agency of making vaccines, Messrs. Novavax Incorporated US, has developed two VLP-based influenza vaccines. One is H1N1 vaccine, has been approved by the BGCI. Secondly, trials of approval by the BGCI. The details of the trivalent seasonal influenza vaccines are shared with you all for your kind information on vaccines. And Atman awarded the title of Life Sciences Pharma of the year 2015 by the Technical Council of Maryland, USA. Outcome of the collaborative development with Novavax Incorporated, US and the Catalan Pharmaceuticals. Is a single dose ampule, 0.5 milliliter, the 15 microgram each of the heme agglutinin antigen of two types of influenza type A strains H1N1, H3N2 and type 2B strain, that is recombinant trivalent seasonal influenza vaccine. Now you see the mechanism of action. The hemagglutinin involves neutralizing antibody prevents infection. Neuromyonidase induces neutralizing antibody reduces disease severity, and the matrix protein, that is M, potential to attenuate the mediated immunity. The immunogenicity of the vaccine was evaluated, and 450 healthy Indian adults, 0.5 milliliter was administered intramuscular. Hemagglutinin antibody titer was measured, and day 0 pre-vaccination and day 21 post-vaccination. And randomized 450 individuals were taken, 300 were given Cadila flu vaccine and 150 placebo. Out of 300, 298 completed the study, 2 discontinued. In the placebo group completed 150, none discontinued. The subject withdrew consent on day 1 after taking the dose, and 1 subject was lost to follow-up. The caddifuous immunogenicity, after giving the shot, it develops a high titer of antibodies within 21 days. So if you give the shot today, within 21 days the body attains the optimum level of antibodies and can prevent the disease. The seroconversion rate on day 21, you can see the highest is H1N1, H3N2 and type B. Can be safely given, used in patients with egg allergy. That is the greatest advantage, because many times we see that egg-based vaccines do cause reactions. Does not contain intact viral genetic material, non-infectious, ensures the exact genetic matching of circulating strains, rapid production in 10 to 12 weeks, and can be safely used in patients with compromised immunity, respiratory disease like asthma, COPD, cardiovascular disease, and diabetes. For active immunization of adults against disease caused by seasonal influenza, virus subtype A and B contain this vaccine. Recombinant trivalent seasonal influenza vaccine. The dose is 0.5 milliliter, single shot once every year, and the administration by intramuscular injection, the tetraid region. The ACIP recommends that pneumococcal vaccine can be administered simultaneously at the same time as the influenza vaccine, but the site of injection should be different. One can be given on this side, the other on other side. In contrast to pneumococcal vaccine, influenza vaccine is recommended annually. The safety and tolerability, safe and well tolerated by majority of individuals. Occasionally patients may develop mild side effects like headache, nasal congestion, low-grade fever, sore throat or muscle cramps, and the efficacy and safety in children and pregnant women is yet not established. Like other seasonal influenza vaccines, it should be used with caution in individuals with moderate to severe illness, with or without fever, history of Guillain-Barré syndrome, within 6 weeks of receiving of influenza vaccine, the contraindication, severe allergic reaction to any component of the vaccine. So summarize the whole nutshell. This is the first recombinant trivalent seasonal influenza vaccine developed with VLP cell technology, induces robust humoral response, provides seroprotection 70% against all 3 strains, free from egg protein, safe in individuals with egg allergy, free from intact viral genome, non-infectious and very well tolerated by most vaccines simultaneously. Each year, scientists create an influenza vaccine that protects against the few specific influenza strains that researchers predict are going to be the most common during that year. Now scientists may be able to create a universal vaccine that can provide broad protection against numerous influenza strains using a cocktail of PLP, including those that should cause future pandemics. Thank you very much.